The Forbes Norris MDA ALS Research and Treatment Center in San Francisco carries on the legacy of Dr. Forbes Norris, the internationally renowned physician in the field of ALS research and clinical care. It is the largest ALS clinical research center in the United States and one of 6 National Muscular Dystrophy Association ALS centers dedicated to the treatment of ALS and muscular dystrophy.
Many people think of ALS as an untreatable disease, but one of our greatest treatments is the ALS Specialized Multidisciplinary Clinic, and the reason it's so important is that it allows people to live longer and more easily to manage ALS.
This kind of clinic should be a model for how we take care of people regardless of the illness that they have.
We have a team that is so diverse, and so we're able to meet really every need that comes along for a patient, and each clinician has such a level of expertise that is so high that I just feel like patients are getting the best of the best.
In essence, what we did was create the concept of a comprehensive, multidisciplinary clinic that follows the patient throughout the course of the illness. And even if we didn't follow them directly, we would work with their physician to help them be cared for in their local communities.
The excellence in the staff, the quality, the depth, the breadth of expertise that we have at the team at the Norris Center, I hate to say it, but it may be second to none.
I'm honored to be associated with this wonderful team that we've put together in this clinic.
When I wheel through the doors of the Forbes Norris Clinic, I am not a 47-year-old woman with ALS. I'm Carla, and I'm treated like Carla. And allowing me my individuality and my creativity and my personhood, my humanity, makes it easier for me to live day to day with this really crappy disease.
When they have a disease that's so difficult for them to understand, it's difficult for me as a physician to figure out how I can help them. And so having a good speech-language pathologist available to help the patient better communicate their needs to me, the treating physician, is invaluable.
Our patients move along quickly with this disease. Unlike other illnesses, one device doesn't fit all throughout the course of this illness. They do need to swap out devices. And we needed an extensive lending library, and now with educating patients about donation and their families, we have a over 1,000-piece lending library, which makes what I do possible.
Well, one of the things that we have at the center is a real in-depth capability in communication, and it's been neglected in many ALS centers across the country. I think in part because it's a daunting technology. And we happen to have somebody, Amy, who is extremely knowledgeable about the full gamut of treatment possibilities for communication. And she really thinks not just of the technology, but of the goal of enhancing and preserving communication, such an important aspect of life for people with ALS.
Amy and the other members of the staff at the clinic have been a tremendous help to me and my wife.
To have people of the quality that Amy Rahman is, who have really at the premier augmentative communication specialist, because this is the one aspect, other than the respiration problem, of keeping patients in contact with their family. And that adds as much, if not more than anything else, to their quality of life.
At the center, we know we can't walk in our patients' shoes or their family's shoes. It's impossible. We can't possibly do that. But what we can do is always we can link arms with them and walk side by side with them through this illness. And so I think that's what we provide.
If we can't give our patients anything else, if we can give them hope and a better day each day, then that's a good thing to get up in the morning and go to work for.
They've helped me want to stay alive.